Hi, and welcome to another Medical Directive Minute. I am your host, Dr. Brian Everett, and today we're going to talk about the new updates to the clinical operating guidelines from the Office of the Medical Director. We're excited to say that we have added a new medication to the formulary that gives options for the safe sedation of agitated patients, especially to those agencies that do not carry controlled substances. Additionally, droperidol, the new medication, has other properties that make it an excellent drug for EMS. The updated COGs are M4 Behavioral Health, M12 Nausea and Vomiting, and M14 Pain Management. Let's start by taking a look at behavioral health. The first thing you're going to notice about behavioral health is that we've broken down the different types of behavioral agitation into mild, moderate, and severe. A mildly agitated patient is one that is able to follow commands, but is irritated and shows signs of pressured speech or disorganized thoughts. A moderately agitated patient displays signs of threatening behavior, such as pacing, hitting other objects, or using an aggressive stance, but is not actively violent. They may also have motor restlessness and difficulty following commands. A severely agitated patient is one that is violent and is an active danger to themselves or others if not quickly sedated. Remember, sedation for agitated behavioral patients is to facilitate safe transport of these patients and to treat a constellation of symptoms that can lead to death if physically restrained. Sedated patients require continuous monitoring and are never to be pruned. It is also important to note that once sedating medications have been administered, physically restraining the patient is not recommended. Patients can often be redirected and with gentle reminders to where to stay as the drug takes effect. For mildly agitated patients, we recommend 2.5 to 5 milligrams of droperidol. If giving IV, please half the dose. For moderate, we increase the dose to 5 to 10 milligrams IV/IM. Again, halving the dose if giving IV. For severely agitated patients, if you have Versed, you may call medical direction for clearance to give 5 milligrams IM Versed mixed with 5 milligrams of droperidol IM or 10 milligrams IM droperidol alone. Remember, it can take up to 15 minutes for this drug to work, so please be patient and allow it to work. You can have a better success if you're able to de-escalate the patient, providing a calming atmosphere and removing agitating persons. All right, let's move on to nausea and vomiting. Droperidol is FDA approved for the treatment of nausea and vomiting. An important change to notice is that we have added Zofran ODT, which is a non-sedating antiemetic for basic providers. We recommend Zofran to be our primary and first-line agent if the patient is not able to tolerate PO. However, if the patient has already tried Zofran or another antiemetic prior to our arrival, or they continue to vomit despite Zofran administration, droperidol can then be administered. The dose is 1.25 to 2.5 milligrams. Again, give the smaller dose of giving IV. Finally, let's move to pain management. Under pain management, specifically, we're looking at the management of headaches. Patients with severe headaches should have received at least a PO dose of Tylenol prior to the administration of droperidol. If a patient with a history of migraines is having a migraine and they've already taken their home abortive migraine medications, then droperidol may be considered a second line. These patients will be sedated, so please be sure to do a good physical exam and a good neurological exam prior to administering the medication. We don't want to miss signs of a stroke. The dose is 1.25 to 2.5 milligrams IV or IM, going with the smaller dose if giving IV. Again, anytime a patient receives droperidol, they need to be monitored with end-tidal CO2 and pulse oximetry. It's also extremely important, due to the potential for QTc prolongation, that these patients are monitored on the cardiac monitor, and a 12-lead EKG is obtained after administering the medication. A QTc of 500 would be a contraindication for the administration of the medication. To learn more about the pharmacological actions, please click on the banner to see our Pharmacology Minute on droperidol. With this, I hope you take the time to learn more about droperidol and consider it in your practice. If you have any questions, please contact your local medical director. Be sure to like this video and subscribe to the Medical Director Minute to get frequent updates on the latest happenings of EMS. Now go out there, have fun, and save some lives.